Good afternoon, everyone, and a very warm welcome to all of you. I am Aliasgar Karmali, a public health student at the D.Y. Patil School of Public Health, Navi Mumbai, and it is my pleasure to welcome you to today's webinar, Discover Why Public Health is a Career of the Future. What we think about healthcare, when we think about healthcare, we often think about treating individuals, but public health takes a much broader approach. It focuses on preventing diseases, strengthening health systems, shaping policies, and improving the health and well being of entire communities. And with growing challenges such as climate change, emerging diseases, health inequalities, and changing healthcare needs, the role of public health professionals has never been more important. To help us explore this exciting field and understand the diverse career opportunities it offers, we are delighted to have with us Dr. Daksha Parmar, Associate Professor at the D.Y. Patil School of Public Health and Faculty Coordinator for the Division of Health Systems. Dr. Parmar brings extensive academic, research, and professional experience in public health, health systems and policy, development studies, gender, social exclusion, and inclusive policies. Before joining Divya Patil University, she served as an assistant professor of development studies at IIT Guwahati. She holds an MPhil and PhD in social sciences in public health from Jawaharlal Nehru University and an MA in development studies from TIS Mumbai. She is also a recipient of the prestigious Dr. Yusuf Hamid Faculty Fellowship from the Mailman School of Public Health, Columbia University, and has received fellowships from organizations including ICSSR, the Rockefeller Archive Center, and the Inlag Shivdasani Foundation. Dr. Parmar has led several national research projects supported by WHO and has published extensively in national and international peer-reviewed journals. Adding to her impressive body of academic work, she has recently co-authored the book The Science and Practice of Public Health: Perspectives from the Developing World, published by Rotlake, along with Professor T. Sundaraman and Professor Sitanshu Eskar. We are truly delighted to have her with us today to share her experience and insights and help us discover why public health is a career of the future. Dr. Pamar, thank you for joining us. We look forward to an insightful and engaging session. Over to you.
Thank you for that introduction and welcome everyone. I'm happy that all of you have joined. And before I go into my presentation, let me just share. And I'm glad that Ali, my student, has introduced me out of his busy schedule at the fact that his submissions and exams are due. So thank you, Ali, for that. And just a minute, I'm just uploading my PPT. Yeah, so welcome everyone. Here in this PPT, we will be learning about, discovering public health from, basically the fact that discovery is all about learning and knowing something that we don't know. So for me, the journey of public health began when I was doing my master's and when I wanted to, understand the health status of the tribal children. So that one subject as a part of my master's in development studies, where I looked at policies like nutritional policies and basically wanted to understand how the policies have impact at the field level. So when I tried to look at my journey of public health, it began with one of the course on social sector policies within the broad framework of development studies, and then I went on to do my higher education as well as my further teaching in the area of health and development, so as well as my research. So here we will learn about why public health is a career of the future, and also discover with me in the next few minutes the entire discipline of public health. So to begin with, as Ali rightly pointed out, okay, just to begin with, I'll take you in this 1 hour or so. Basically, the structure of our presentation, we understand what is public health. We try to look at as to why public health is important and critical at this juncture of our time. Okay, it has been historically important, but what it is that makes it much more significant in the contemporary times. As we go along, we try to also understand how public health offers and explore basically the career opportunities that are there. We learn basically about the larger ecosystem within which the public health scholars, researchers and professionals contribute. We also try to understand where it leads us to. Okay, basically looking at the opportunities as well as link it with the program that our school offers, and like lastly and most importantly, we try to understand whether it really interests you, and basically to look at whether you are the real fit for the program or so, so to begin with, whenever I teach health systems or public health, we often try to think of health as something related to well-being. We But historically this was not the focus. Historically, health was always looked upon as related to diseases, like absence of disease. So like when you look at health from that perspective, that focus is largely about treating one person, one patient. Okay, and basically we look at health, as I said, from the perspective of absence of disease. So where we look at what are the symptoms that have occurred, we go to a doctor, right, a health worker basically, who will diagnose and give a name to the condition that we are suffering from, right? And then at the same time, the health worker, the doctors, the health professional basically help us seek, provide treatment, right? And then basically based on the treatment, we try to recover. So the entire focus of like learning about health was largely about understanding basically the disease, the illness, and ensuring that the breakdown which has occurred in the human body because of this disease is like addressed, is repaired. And basically the human being, the human body, tries to go back to its normal role that he or she is to perform in our society, right? So the historical focus has been largely looking at one person, an individual patient. But when we talk about public health, okay, we talk about not only like the patient, but we want to actually prevent illness. So the whole focus is about prevention. We try to understand and basically investigate what are the diseases which are making people sick. Okay, okay, what can we do as public health professionals to ensure that people don't fall sick? Can we take our evidence to the policymakers and ensure that we have some kind of programs which will strengthen our systems so that we do not have so many people falling sick of this disease, right? So with that focus, we shift, like our lens largely shifts from individual to look at the populations which are based in different communities, be it in our country, be it at the local level, or be it at the global level, right? So the whole focus of public health as a discipline is basically to ensure that we protect communities largely by preventing the occurrence of diseases, and most importantly by promoting healthy behaviors amongst population. Okay, though even when we talk about the fact that we work with populations, our interventions are also at individuals, right? Individual behavior is basically largely we intervene at individual level as well. But the whole focus is we ensure that the scale of our work is not only at one individual but at the communities. So that has been one of the most important focus and contribution of public health. Now just to make you understand, why we have to talk about public health, or why we have to discover the career prospects within public health, largely because when you think of medical science vis-a-vis, the contribution of clinical medicine vis-a-vis improving the life of population, the contribution of public health has remained historically invisible. Okay, but the contribution that public health and public health scientists as well as scholars have made has been largely behind, okay, the behind the curtains, and which has not been basically made visible vis-a-vis the way in which we often see the effectiveness of medical interventions, right? We often see, okay, this treatment has saved the life of my patient, But we often don't think of the fact that what is it happening behind to ensure that not many people fall sick. And that's where we talk about the determinants of health, where the public health scholars, public health professionals, and public health workers work towards ensuring that populations have access to food. We often talk about the signs of diseases, right, the various disease which are there. We, as I said, we also look at the policies, like what do we do to ensure that not many people fall sick. We look at the broader determinants of the environment within which that individual or populations are living. We also focus on the fact that we don't have to wait for people to fall sick. We have to have a system in place which will basically record various disease outbreaks which are happening even in remote villages. Okay, so we do a lot of disease surveillance. So also, most importantly, even when, even when we are working towards prevention or preventive aspect, our focus is also to build and strengthen the health systems which are there, that in case people fall sick, we have a very strong and a robust health systems which ensures that people recover. We also have to talk about, and we also study the importance of water and water scarce, security is one of the, like, the kind of water, the availability of water, the accessibility to water, what kind, like the quality of water that we are drinking. That's a very important determinants of health. And with the rising pandemics, okay, the fact that we lived, I'm sure most of you have lived through the COVID-19 pandemic, the fact that there has been a lot of interconnections between animal health and the way in which, viruses transmit to the human, like, population. So we also focus a lot on the entire important aspects of one health. And lastly, as we all know, like, there has been this rapid urbanization that most of the countries of the world are witnessing with the development process which is unfolding. So we also focus a lot on understanding the urban, like, the impact of urbanization on the health of the population. So what I'm trying to help you understand, that public health is, working behind the door. It has been largely contributing to ensure that people's life, people, like the conditions of living of populations are better. Okay, and that they don't fall sick. But it also ensures that it works to build health systems which will respond to in case of an illness. Now, the one of the classic definitions of health given by Professor Winslow, long back, and which has been adapted by the Hsn report in 1998, defines public health as, the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. And public health involves, different disciplines and basically different subjects that you will be studying over the course of time. And it is largely the fact that it's not only one course, one discipline as such, but it involves different courses. Okay, it draws from multiple disciplines to make public health, basically it includes range of subjects, from epidemiology to basically looking at the data that we have of the different kinds of health indicators. We often do a lot of research. As I said, public health is one of the most important discipline of social science. Social science contributes a lot to the discipline. We also have to talk about people's behavior. So what do we do to promote good health? Most importantly, we also study about information, and in today's time, the way in which information and technology interface, and, focus on health informatics to say. We also learn from or understand the contribution of economics and financing to the entire aspect of public health, as well as something which our school has been pioneering, and, basically trying to connect and understand the intersections, is basically the linkage of environment and public health, something that we see is very important when it comes to the health of the population. And in the times where, where we are witnessing rapid climate change and its impact on population. So apart from the courses and the subjects that we try to integrate within the discipline of public health, We also think it's that class, it's, it's the learning doesn't happen only in classrooms, but we also provide, basically a lot of field experience through fieldwork, which is an integral part of all the courses. Okay, so what do we learn here? That public health is not only science and policy, but public health is a discipline which is very interdisciplinary. Okay, meaning it draws from different discipline to enrich its understanding, in order to understand basically the meaning of public health, which is all about the health of the populations. And it draws, so clinical medicine is a very important integral part of public health as a discipline. We also use a lot of health information, so data, and the way in which data has to be applied in terms of data analysis, the evidence that we gather from, right, the communities, from the population, from the various data sources which are available at global, national, as well as local level. We also make use of, as I said in my previous slide, that technology is a very important aspect of understanding and the entire contribution of public health. So we basically try to look at various kinds of health technologies which are there, which are necessary in order to improve the public health outcomes, as well as the interface with environment. We work with people, as I said, with populations. They belong to a social context, to a society, excuse me. And also the fact that there is a lot of emphasis on not only drawing evidence, building new evidence or understanding its application, but also to ensure that the evidence which is produced is, is basically translated into actions at the policy level, which necessitates that we work with the government. And most importantly, we also work towards, basically the fact that management and different organizations which provide care, we also basically try to integrate the principles of the disciplines of management, in order to basically ensure that public health is, becomes much more rigorous as well as interdisciplinary when it comes to the discipline itself. Okay, then as I said, it is a field of the future. And why it matters? This is because of the way in which, the larger structural factors, the larger environmental factors, okay, is basically affecting the health of our populations, right? Be it, as I said, it is happening in one part of the world, but the interconnection or the interconnected world that we live in these globalized times, affects the way in which one disease, which is an outbreak at one particular local level, has a threat to become, from a endemic disease to become a major pandemic, right? So also that has been again complicated by the way in which our climate is changing, which is basically resulting in rising temperatures, which we all are experiencing in terms of the various heat waves. I'm sure you might be reading about what happened in Europe and how they were basically trying to address heat waves, right? What is happening in our country, what is happening to, how is heat impacting our population, and most importantly, how human health is being affected. We are seeing the occurrence of new emerging diseases. I'm sure you might have heard about hantavirus, right, the Ebola virus, the dengue fever. So there are different new diseases which are basically infectious in nature and a threat to the health of the population. It's not only the infectious diseases, we also now have a population which is living with different kinds of chronic diseases, and which are lifelong, but which also basically provides it, which also basically is increasing the illness burden, the disease burden on our population, irrespective of the fact that we are living longer. Like the life expectancy might have improved, but the fact that our population is living with different chronic diseases ranging from hypertension to diabetes to say cancers. So what do we do with, how do we respond to ensure that People do not, like, what can be the preventive aspect that we do in order to ensure that, people do not develop chronic diseases. I'm sure most of you can understand the fact that given the fast pace of our life, given the deadlines, the burden, the pressure to perform, there has been over the years a silent epidemic which needs to be addressed in our country, which is the entire mental health condition. Right, the different population groups, different age groups, different genders suffers from different kinds of mental health conditions. We need to address that. Most importantly, given the demographic and the health transition, apart, along with the epidemiological transition that our country is witnessing, we are also seeing an increasing burden of, the aging population, the population which is growing old. So how do we address the health needs of a growing older population? We again are a society which is highly unequal, right? There are different kinds of social inequalities which are also then reinforced in our disparities between the, basically between the different social groups in terms of their health indicators. So how do we ensure that the health inequalities, the gap between different population groups with respect to the morbidities and mortalities are addressed? What can, like, how can data and, digitization help us, like, what is happening to the entire aspect of digital health, which has become one of the most important buzzword, right? So, and most importantly, as I'm sure some of you will understand, the fact that we are also witnessing different kinds of disasters, right? Different kinds. So how do we prepare our systems to respond to these emergencies? So, like, that it is. So when we talk about public health, when we learn about public health, there has been in the present times and in the complex world that we are living in, different factors and the intensities of these factors have basically increased the, the need for understanding the entire discipline of public health and its interconnections with the health of the population. Okay, so as we said, it is not only one discipline. We need different discipline, we need the expertise, the knowledge as well as skills of different disciplines to deal with a crisis, basically the problems that we will face, which are much more complex. Now, in order to deal with this problem, we also need a lot of health workers, right? So it cannot be only few health workers or human resources in health. So as WHO has projected, there is a need for, like 11 million health workers. So there's a shortage of health workers, right? We need more health workers within this sector. Okay, so that's where the public health careers basically are very important, and that's where we, there are different careers which are available, and that can be, say, depending on, if I can use certain uh, like jargons in terms of the contemporary times, the fact that we can have different opportunities for people who are interested in doing some kind of detectiveness when it comes to the health detective aspect. We also have opportunities of basically data. Some people are very interested to work on, with different data sets by using the present digital technologies which are widely available. So we also have various careers, or, basically opportunities available for people who are interested to work with the systems, with the policies, with institutions which, basically make policies. Again, people are also, and, students are also not only interested in identifying our data related or systems, but also the interconnections between environment and climate. Okay, how do what are the opportunities available there, and most importantly, also on the determinants aspect, the people's behavior aspect, right? So how do we work at the community level to promote good behaviors, okay, or create literacy or health education at the community level when it comes to promoting good health, right? So these are some of the career paths that we can think of, like, so just to think of, if there is an outbreak, so what has been, say, the role of the health detective, right? So just to think, make you think of a real world scenario. Think of, the fact that in our neighborhood there is a disease, okay, a condition has developed and people are falling sick. Okay, like 30 people have fallen sick, and there are epidemiologists whose role is to basically identify the cause of the disease, like the what are the factors which causes this disease. So basically, if health, if you are very much interested in being a detective, so you basically think of working as a health detective, where you identify, basically you collect data from the field, you go and meet people, you understand from the data that you have collected, you try to understand some kind of pattern that you will observe. Okay, as to there was an exposure, people drank water which was contaminated, or people came in contact with a vector, right? So you basically try to, based on the data that you will collect, identify certain pattern which will help you understand that there are certain risk factors, there are certain factors which are making people much more vulnerable to the development of this condition, this illness. Okay, and then basically you go to the field again, investigate the way in which the outbreak occurred, and by talking to the people from the ground, and you try to basically recommend action for, as I said, it's we don't collect data only for as evidence, but that evidence needs to be undertaken to prevent, right? So the whole focus is actions that are taken to ensure that, we do not have the new cases which will emerge from the community. So we basically try to prevent, right? Now, just to map, the fact that if you are interested in such kind of roles and response, like opportunities, then the way in which we have, designed our syllabus is basically we have different courses within the program which trains you to be, or be a health detective, to put it in simple words. So we have different courses ranging in epidemiology, social epidemiology, we have courses in statistics and biostatistics, research methodology, as well as how do you manage data, so on health data management, right? The second one is basically to make you think about, we have so much of data, and the fact that there is a lot of emphasis on digital health. So how can we basically, like, and as government of India has announced this program called as India's digital health mission, which is about, a very very important flagship program to ensure that we have electronic health records of most of our people, when it comes to our country. So, how do we ensure that we are collecting data, and which has been stored in different devices, we are analyzing that data, which will help us get some kind of observations and insights. Okay, that data, the information is now being turned into a very important insight, okay, which will help you make certain kind of decisions with respect to, say, what kind of health services people are using when it comes to, say, chronic illness. So you basically get some information, some data which has been, been made meaningful and been converted into an evidence again, then also to ensure that we take certain action in order to, basically bring about and implement policy reforms so that the health outcomes improves. Okay, so link to this aspect of the opportunities, the careers that we see in our, in the present contemporary times, we have basically, as right as also discussed in the previous slide, we have foundation of statistics, we also have, courses basically which train students in health data management, informatics, the GIS of the environment, right, as well as the research methodology. Now, the third career direction that we can explore is basically about the policy and health system. As I said, like, we have to build evidence, we have to generate evidence in order to ensure that the governments make policies, right, in basically to ensure that those policies are to be implemented, and there is an intention, right, to ensure that people live a healthy life, right, populations live a healthy life. So when you are interested in that kind of a career, we basically gather and review evidence, we try to, make priorities and make decisions out of that. We also try to think of budgets and, how much funds have been available, what can be some of the activities and interventions that are necessary to implement a program or a policy. You have to break down that into multiple activities, which involves, working with different stakeholders, which also involves that you identify who are your target groups, right? And most importantly, you have to work and ensure that the plan or the policy or the program which has been designed is implemented and put in action at the field, in the ground. Okay. And it's not only the fact that you implement it. Okay, maybe have a number of programs that we have formulated, there has been a lot of implementation challenges, but most importantly you also have to regularly monitor it, right? It's not only, as I said, formulation and implementation, but also to understand whether what impact it had. So you have to do a lot of monitoring and evaluation, okay, in order to understand the objective with which we had started, is it really making an impact, right? Just to help you understand, to think of example, is basically the fact that, again, India is known as the diabetes capital, right? They're given the number of millions of people who suffer from diabetes in our country. So if you want to reduce diabetes, right, so how do you intervene? So what should be your policy, right? It should be, so how do we decide whom to target, where is the fund available? So we basically train you in order to ensure that we plan a diabetes prevention program, which is already there in, the government of India has a NCD, national program for control of non communicable diseases, right? So basically we map it with the curriculum that we have. So we train you to understand, say, how our health systems are organized in the country, which are implementing various health programs, which are national health programs made, formulated by the government. We also train you, as I said, to the basics and fundamentals of health economics, to understand, the way in which financing, or the way in which insurance, right, they all work, and as well as the expenditure that people incur when it comes to healthcare. Now, we, as I said, we will also, basically, the program of the health programs and policy and design and implementation orients you to the various national health programs that are there in our country, say from immunization to mental health, right? So different programs. And as I said, most importantly, we also orient you to the and introduce you to the concept, the ideas of health management, right? And the various principles and practices in reality. So theory is one thing, but also the fact that you have to implement it, and ensure that there is uh, a link between the theory as well as the practice. And lastly, the research methodology, and something which is very important in the present times, and as I said, which has been our focus at the school, is to understand the interconnections between environment, climate, and health. And where, suppose we are thinking about different adverse climate events that are happening in the present times, and which, the future generation or the coming generation, in the coming decades, is will be facing a much more of its impact, right? So basically, how pollution is affecting our health, how increasing heat, right, heat related illness, the fact that there are water shortages, there are, there are basically droughts at times, or water is getting contaminated due to water pollution. So how all this also affects the health of the population, right? And then basically we have courses, which teaches you about the interconnections between environment and health, the various toxins in the, in the environment, the various pollutants in the environment, which have various, short term as well as long term impacts on our health of the population. And again, we have, courses which aligns with this career direction of understanding the interconnections between environment and health, as well as, occupational health, or work labor and health, which is also the focus, as well as how do you prepare yourself, to deal with various kinds of climate hazards, okay, as well as various disasters. So we also train students in that aspect of ensuring that we are prepared as systems to respond in case of a crisis or a disaster. The next career direction is largely when it comes to working at the community level, when it comes to nutrition, which is a very important aspect of our health determinants, okay. And like, as I said, it is all about people. We work at the community level, to understand, like, how do you promote or improve maternal nutrition. Okay, so there are different disciplines which come together. We have to basically make various health promotional campaigns, so that we talk when we work with the community, we engage with them, and we basically try to create more of good health promotion activities. And that will come only when the community has a trust, trust of the winning the trust of the people. Why prolonged community engagement is very important, and that over a period of time will bring about a sustained and a long term change in the behaviors of the people. So aligning with that, we have various courses on health promotion and communication, the public health nutrition, the sexual and reproductive health is a very important aspect, as well as we study, as I said, the social sciences and its interconnections with the public health, as well as gender and health. So where, like, after being trained in all these various subjects, okay, where can you work, which has been very important focus of the discipline of public health, as to there are multiple there's not only one organization, there are multiple organizations where you are eligible to work, be it in the public sector. Okay, the government of India, we have different departments. Okay, we have different missions. The national health mission is a very important program of the government of the Ministry of Health and Family Welfare, as well as government of India. Ayushman Bharat again is a flagship program which has different components of strengthening health systems, as well as promoting the fact that people have access to universal health coverage through various insurance policies. As I said, we work not only at the national level or in the ministry, but also at the state level, the state health departments, as well as in the city urban health, right, the city health departments, so which are we have opportunities there. Apart from the government, we also have a number of global health agencies, right? WHO, UNICEF, World Bank. There are different global health agents, like the agencies which work with, for which health is their technical integral aspect or focus of interventions, right? Apart from the government as well as the global agencies, we also have number of NGOs, right, for, like, who work on various aspects related to health, be it health promotion, or basically improving health outcomes at the population level. As I had previously said, it's not only about different policy as well as international organizations. We also have a huge system of organization of care, right? So we have different health institutions which are providing health care, and there are a number of opportunities even in various hospitals and health facilities, as well as different teams which work to ensure that quality care is provided to the population. Research is a very important sector where public health scholars, public health students contribute, particularly by studying a topic in depth. There are different organizations, national level, which are working on various kinds of medical research. ICMR is one of the very prestigious institution of government of India. We also have the Public Health Foundation of India and the National Institute of Epidemiology. We also have in the contemporary times, and the various health tech firms and consulting agencies, as well as various startups that are there, which ensures that we have various kinds of digital apps which have been developed by young entrepreneurs. So that is also a very important area, sector of work, where you can be interested to work. Now these are some of the career opportunities for a BPH graduate, right? Just to begin with, basically various public health programs where you are basically eligible to work as program associate or project associate, with an average salary of 3.5 to 6 lakhs. So these are like different, as I said, the different career paths, be it if you're interested in research in epidemiology, if you are keen to work within the team which does research or basically monitoring and evaluation of various health projects or different programs, We also have a sector which is expanding rapidly, as I said, with the IT, and the digital digitization, which has been the focus. We have health data and analytics, the digital health and informatics. We also have positions or entry level role within the community health, right? So community health outreach program associates, as well as health promotion too. Like, these are some of the clinical research coordinator, has been one of the most important area within the pharmaceutical industries. Okay, that has been a very important field, and health systems and health policy, as well as various environment and climate related organizations, right? So there has been, like, different career paths which are high potential pathways. And also, as I said, there are multiple recruiting agency, not only one agency. Okay, to start with various national level organization to various global health actors and institutions, which has been working towards integrating various health sector related interventions. Many of, just to put it, because this is a graduate degree, right? So many of our many of the BPH graduates can also pursue higher education, which is a professional, PG, postgraduate degree, a professional degree, which basically of masters in public health. You can also do various basically MSc or masters in public policy, in order to grow further, right? So from entry level you gain some experience, but at the same time, if you're interested to develop your skills and competencies further, you basically also are can do a postgraduate degree, right? So just to talk about what has been the 4 years journey of a BPH program. So first, the whole focus is to understand. We basically start with foundational. We try to introduce concepts, ideas, in particularly from different discipline, as we began with, right? To basically identify and connect the various sectors that you are looking into, which basically have a direct impact on the health of the population, right? You collect information, you understand various systems, you look at the larger environment within which people are living, by, most importantly, by secondary literature, but also most importantly through doing field work at the community level. Then we get into investigating, right? This is, as I said, over the years, the whole focus now first is to understand, then interconnect and understand the determinants, right? Then basically to get into the investigation part, where you learn about this in like epidemiology, policy, climate related, and then lastly, where you try to apply what knowledge you have gained, okay, into real life understanding of be in informatics, be or managing. You also basically learn and do your, those who are not interested to do a research project can also do a practicum in their fourth year. So this is largely the 4 years journey. And as we are talking about the skills that the various skills that you will learn, okay, will build your capabilities, okay, over the years, to understand the concepts of health and disease, to also basically learn about and investigate about epidemiology and research. You learn a lot of problem solving skills, you learn to analyze data, you also learn to map, understand the GIS and the spatial health disparities that you will be observing. You learn to, most importantly, communicate, like public health communication is very important, as well as you work towards managing a health system. And you also work towards designing. So the skills that we will be embarking upon, or that you will learn, is also to design different health programs and policies, okay, and also apply that based on uh, the field work that you will be doing, the research, as well as the practicum. So just to, like, understand, so what does this degree for whom is this degree most ideal? Likely for people who are passionate and who care about people's health and well-being at the population level, as I said, who also learn and are like enjoy the mix of science as well as various social issues, and learn, basically are interested to make use of data, that those who are also interested to, as I said, do research in a systematic way, gather evidence, gather data, and collect data and gather evidence, as well as those who want a meaningful and purposeful career. Most importantly, you are also drawn to the field, to the real world out there, where most of the, where we have to understand the health problems, and most importantly where you also believe, right, that we don't have to wait for people to fall sick. You have to basically intervene to ensure that then they don't fall sick, right? So you also work towards ensuring that we prevent illness, we promote good health, and lastly also to ensure that good health is basically, healthcare is also it's a public good for everyone, okay, from where you cannot exclude anyone, right? So it might not be the fit, if you are only interested in say one subject, or largely clinical, that you also want largely a textbook oriented defined career, or if you're very much only your focus is largely say just to make high, like if your interest is largely on making high salaries, you don't want to, like you don't like field and want to don't enter the field, or you, or most importantly you need high paying jobs, okay, or or you look to only work in corporate business roles, right? So because this discipline talks about working for the populations, right, that sectors can be different, okay, as we had discussed. So weighing it against the traditional clinical courses compared to which the courses which are quite popular, and which people often think of the only options that are available to do is medicine, or becoming a BMS doctor, or bachelor's in physiotherapy, or to do only say the allied clinical health courses, okay. What we have tried to give you is basically the BPH, as to think about the advantages is based, to think of it as a multidisciplinary course which combines different disciplines, and in which we train you, right? We train you from understanding the science of disease to also the various management as well as social science related courses, which again, as I said, there's a huge demand for this discipline, and it is a public health priority, like building strong health systems or developing public health professionals is one of the most important focus of at the global level as well post the pandemic. We also work across, as I said, in different sectors, not on necessarily in one particular uh, field, okay. We have different sectors ranging from global health agencies to government to NGOs to research as well as startups, and the consultancy firms that we all know. We also, as you have to remember, it's all about bringing working at the community level to have real life, real world impact, and which is like largely sustainable and purpose driven. The fact that you are working towards prevention, the whole objective is to promote equitable health and well-being for the population, and also the fact that BPH provides you a very strong pathway for your higher education, depending on the different disciplines which are there and which you want to explore further for your career and professional growth. So basically you have to also remember that this is a field which was not less traditionally recognized. We often think of only medicine and engineering as the options which are available. So BPH basically uh, needs needs to be recognized, and the fact that has been needs to be visibilized, okay. We also have to remember that self direction largely depends on your interest and initiative. Um Largely the fact that it is the roles of public health graduates is still emerging in some sectors in many organizations. As I said, it's an emerging field, it's a rapidly developing field. The landscape is changing post the pandemic rapidly, And though to begin with the salaries might be modest, but once you obtain an experience of 1 year or 2 years, there is a growth or career progression which is very much evident. And remember, it also requires a broad interest. Okay, it requires the fact that you work with different stakeholders, not necessarily only one office or one patient, but you work with people from different organizations which were involved in different kinds of systems. And also you have to work with people who produce data, right? Data of different kinds, be it health information or people about data about people's usage of different kinds of health services or policy documents, as well as communities. So it is, say, not only one specialized subject, but it develops your skills at multiple level. Okay, so just to briefly talk about our program, so how the BPH program that we have at our at the school in the university, as as one of the very important degrees, very important course. So it's a 4 years program. It is spread across 8 semesters. We have 2 semesters in 1 year, which is 160 credit programs again. And the number of seats that we have as of now is 20. And it's a full-time program, an undergraduate program. And as I said, the whole focus based on what we understood about the discipline of public health is to, basically make you interdisciplinary public health, or train you into a interdisciplinary public health professionals who can understand the health problems which are there, produce and understand, analyze evidence, work with people and populations, and most importantly also work towards designing and developing solutions which are very much grounded at the based on people's needs. Okay, and work also with the systems, policies, as well as the larger society in which we work with. One of the most important features of our program is the fact that we, as I said, it's a discipline which is very integrative. It integrates the knowledge from different disciplines and enriches itself. So we try to basically draw from sciences, health sciences, epidemiology, statistics, social sciences, management, right? And most importantly, we also have an option of an integrated MPH, meaning if you finish your 4 years and if you want to do a master's in public health after your 4 years, uh, your master's is of 1 year. Like historically, it's master's degrees of 2 years, but as a part of the NEP, the National Education Policy, we also have an integrated MPH program for our BPH graduates. Okay, so you do 4 years of your MPH, ensuring that you maintain your CGPA in terms of your academic performance, and then you are eligible for an integrative master's degree of 1 year. So this is the vision of our school. We are working towards catalyzing change and most importantly to nurture the leaders of tomorrow. And we work with the mission that we are dedicated to shaping the leaders of tomorrow through our insightful pedagogy with lot of impactful research that we do. We also work towards ensuring active community engagement and most importantly the teaching, research, as well as community engagement. We try to, as I said, work towards ensuring that we do policy advocacy to bring about change at the policy level as well. So okay, just to which I missed, we were established in the year 2020. I'm sure you all know that was the year that the world witnessed the COVID-19 pandemic. For our master student, we have over the years they have, like, that was our flagship program, the masters in public health. So they have 100, like all of them have been placed. We are very happy and proud to say that. And as per the IIRF rank, we are ranked third in the state of Maharashtra as a public health school. We, as I said, the school not only offers BPH, okay, something that you have studied, like you just came to know about, but we also have another most important program, which is the BSc in Environment and Sustainability, for which UNICEF is our knowledge partner. And we also, as I said, not only offer bachelor's program, but we have three different postgraduate degrees. or programs that we offer, ranging from Masters of Public Health to MSc in Environment and Sustainability, as well as the Masters in Public Policy. Um, Now all this programs and training that is happening in our school is not possible without a faculty and our dean, who has been led by the school that is led by Dr. Suma Nair, and we have various faculties from different reputed institution, from JNU to IIPS to TIS, right? So as well as we have faculty colleagues in the division of health systems from University of Ann Arbor. So Bhagyalakshmi is from there. We have different faculty like expertise from different reputed institutions who are working to provide and train the future students at the school. And we have the school which further divided into four divisions: epidemiology and population health, health systems, that is within the school, environment and sustainability, and policy and governance. And we also as a school have lot of collaboration. Our students work and spend time and work and learn, as I said, collaboratively, not only in the classroom but also in the field. So we have collaboration with the eco network, with PHFI, with mission rabies. Okay, UNICEF, as I said, is our knowledge partner. So there are various opportunities and collaborations that we do. We also have international associations and MOUs with McGill University, which also offers number of summer courses for our students, and which our students can enroll in and learn online, which also basically makes them much more knowledgeable when it comes to the way in which different subjects are taught at the McGill University. Apart from the summer courses, we also have various research projects which are being done in collaboration with the McGill University, related to digital health, which has been headed by Dr. Suma Nair. We also have another project with WHO under the tropical disease research uh, grant, and which is all about mapping the climate variability and infectious disease hotspots, a gendered and a intersectional vulnerability study of the Mumbai metropolitan region. And we also have a MOU with the University of Aberdeen, basically when it comes to the dual degree master's program with the university. As I said, field immersion is a very important component of our training and teaching. So we, students go to different communities in different places across Maharashtra, right, in Mumbai and Navi Mumbai, depending on what is the focus of their curriculum, and they learn from the field. We also have global immersion programs, right, where a student went to UK to learn about the public health and of UK. Apart from that, we often do, as I said, summer program for letting new students who are interested to learn about the various epidemic X, or outbreaks of epidemic, or to learn about, like, in this year we had about the case of a choking lake here in Navi Mumbai. And there are a number of events at the university which keeps happening, and we are happy to say that our students participate in that wholeheartedly. So there is a lot of learning, not only within the classrooms but beyond the classroom learnings that are there. We also have a very proactive career and placement cell, which basically uh, provides a lot of guidance to the students in terms of ensuring that they are placement, basically they are ready for the outside world once their education is over at the university. And we prepare them to for the professional world that they will be working in post the university education. We also have internship opportunities and industry engagement and career guidance. So these are some of the organizations with which our students have done internships, starting from, as I said, government in, like, government organizations of NHM, to the NGOs, to say the Tata Consult, the TCS services, research organizations like ICMR, as well as, say, the Mission Rabies India. So we have different organizations where they work. And just to conclude, the fact that our admissions are still open, and we also have limited opportunities, we also have limited scholarships which are available. So if you are interested, please do connect with our admissions team at the university. So thank you. And if you have any queries, any like, if you have any doubts or any queries which needs to be addressed, I'm happy to address them. Yeah. Sagarika.
Yeah. So
Yeah.
there are some queries in the chat. The first one is asking if there's any age limit to do a BPH course.
Yeah, so since this is a undergraduate, this is an undergraduate program, so we would basically prefer students, within that age group, like, basically till, I think around 30, if I'm not wrong, because, 25 to 30, if I'm not wrong, because this is a young age group. So we would prefer to have students of that within that age group. So that is, there is an age limit. It is not open for everyone beyond a particular age group, given the fact that it's an undergraduate degree. The admissions teams can, comment on that once, they are, if they're interested to know more about that.
Yeah, I think as Dr. Daksha rightly mentioned, the age limit for our bachelor's program is 25 years.
25.
And if,
Okay.
yeah, and if you are interested, and if you are already a bachelor and want to do a master's degree with us, we can get back to you through our admission team. So yeah,
Yeah, thank you, Shweta.
yeah.
Any other queries?
Dr. Daksha, Abdul Razak wants to ask that are we organizing a webinar for PhD in Public Health program, and if there is any coursework for PhD in Public Health?
Okay, for PhD in public health, we can plan. I think we can plan for a webinar. We need to discuss with the CIDR team. Uh, there is a coursework, yes, very much. We do have a course. I think you have to do two core courses, which is largely on research methodology and ethics of research, if I'm not wrong. And you also have to do subject specific, like your school specific. Courses, depending on what research that you have to do, depending on the topic of your thesis proposal. You can choose, the school offers multiple courses, so you have to choose depending on what is your research topic. You choose the course which is much more relevant to you. And I think epidemiology is something which all the students of public health have to do, as one of their subject courses. So it is research methodology, ethics of research, and two other courses which are basically related to your thesis.
Thank you,
As far as
Dr. Daksha. And
yeah,
I would also like to mention that for our PhD program, there is an entrance exam which you have to write, followed
yes,
by an interview. So our team will get back to you on this, and I will give you more details on when is the next cycle scheduled.
yes. Anyone else?
There's this another question where the person they've asked that if they can move abroad after completing their masters in public health.
Masters in public health,
Yeah,
yeah,
yeah.
of course. Yeah, yeah. The MPH degree is a professional degree, and I'm sure it gives a lot of opportunity to do, like, go abroad and like pursue your careers, as well as, further education. Of course, yeah.
I think Mr. Abdul, our admissions team will get back to you with all the details. We are the faculty working here, so they take care of all the entrance and CIDR. It will get back to you. Don't worry. If you can, I think we have your email and your details. If they are correct, they'll write back to you soon.
Since there are no more questions, I think we can conclude the session.
Okay. Yeah.
Yes. Thank you so much, Dr. Daksha, for sharing your valuable thoughts and taking the time to be with us today. And a
Yeah.
heartfelt thank you to everyone who joined the meeting and made it meaningful. We are looking forward to welcoming you all to our school and hope to see you as part of a school community soon. Thank you so
Yeah.
much.
And thank you to our technical team, which has been working, at the back end to ensure that every webinar is conducted. Thank you so much. Yeah. Bye bye.